ALCAPA refers to Anomalous Left Coronary Artery from Pulmonary Artery. It is a rare congenital coronary artery anomaly in which the left coronary artery arises from pulmonary artery instead of aorta. So what happens is, instead of carrying oxygen-rich blood of aorta, the left coronary artery carries the oxygen-deprived blood of pulmonary artery, which leads to decrease in blood supply or decrease in oxygenated blood supply to the myocardium, and hence results in ischemia, heart failure, and sometimes even sudden cardiac death if left untreated. Symptoms are usually difficulty in breathing, poor feeding, and failure to thrive. These symptoms usually present early in the age, usually between 1 to 3 months. The diagnosis is usually made first on echocardiography. In echocardiography, you suspect this disease when you find a dilated LV with poor contractility. You don't see left coronary artery arising from aorta, but you see that the left coronary artery is arising from pulmonary artery, and the blood flow is usually from left coronary artery into the pulmonary artery during the diastole. This abnormal blood flow patterns helps in diagnosis of ALCAPA. But this requires expertise and skill to diagnose it, and usually a high index of suspicion in any infants who is presenting to us with heart failure. The management usually involves re-establishing the normal blood flow, which requires surgical correction. The long-term and the ultimate goal of surgical management is to optimize the cardiac function and improve the overall prognosis of infants with ALCAPA and enabling them to lead healthy and active lives. Present case of which I am going to show you echocardiography was a case of 2-month-old male child who presented with breathing difficulty in feeding, suck-rest-suck cycle, and inadequate weight gain. X-ray showed cardiomegaly and pulmonary edema. Saturation of the baby was 78%, not properly improving on oxygen and hence requiring intubation and invasive ventilation. With above history, patient came to me, and on echo, I found that the dilated LV, poor contractility, mitral regurgitation, single coronary artery RCA from aorta, and left coronary artery arising from pulmonary artery. The blood flow from left coronary artery to pulmonary artery could be seen predominantly in the diastole. Diagnosed as ALCAPA, patient was referred for surgical correction. Following is the echocardiography video of this patient.